Hello there. This is Dr. V. Kumar Vadivel. I'm a periodontist in the Dallas-Fort Worth area, and welcome to our show tonight, Truth with T. And I'm so sorry about the technical difficulty we had in the last few minutes, and I'm so glad we are ready to rock and roll and get started. And I have Reese here, who's my co-host, and he's going to help us with tonight's show. And welcome you all. Let's rock and roll.
All right, let's just dive in since we're starting late. Let's start with question number 1. Can a person really develop mouth cancer by chewing on the inside of the cheeks?
Great question. So the question again is, can a person really develop mouth cancer by chewing on the inside of the cheek? The answer is no. Just by biting on the cheek or chewing on the cheek, you're not going to develop cancer. However, you may see some white spots or some red spots. They kind of develop, and you may think it is looking like a cancer. It is actually not. However, people who are smokers and who are alcoholics and you use a lot of tobacco, stuffed tobacco inside the mouth, and if you have an open ulcer, the chances of you to get oral cancer is although likely. So if you're not a smoker, and if you don't drink out much of alcohol, and if you don't use any of the tobacco products, the chances for you to develop cancer from just by biting inside the cheek is almost unlikely, so you can have the peace of your mind. Okay, thank you.
All right, yeah, so that's good. You can chew all you want. All right, let's go to question number 2. This one comes from our website. Looks like whitcomb@hotmail.com submitted this to us. The question is, for the past 10 years, I have a tongue ulcer that comes and goes. It causes slight discomfort and then disappears for a couple of months. It is small in size.
So the question is, for the past 10 years, I have a tongue ulcer that comes and goes. It causes slight discomfort and then disappears for a couple of months. It is small in size. So it is not uncommon for you to get ulcers that come and go. And a lot of times we call them as canker sores. And medical term for that is we call it as aphthous ulcers. And to be precise, we call them as recurrent aphthous ulcer because they keep recurring over and over. So we call them as a recurrent aphthous ulcers, or we call it as a recurrent aphthous stomatitis, which means inflammation of the gum tissue. So what you're referring to is those canker sores that you're getting inside your mouth or anywhere in the tongue or anywhere within the oral cavity or in your mouth. It can happen. Yes, it is going to cause some discomfort. Yes, it is going to come and then disappear over a period of time. And it is going to be smaller in size most of the time, or sometime if you're slightly immunocompromised, or depending on your immunity or the strength or your immune system, the ulcer could be as big as maybe even a quarter size. It could become really big. Sometimes it could be very, very painful, although you are saying that it causes only slight discomfort. So long story short, and it is completely okay, and it is going to cause some discomfort, and it is going to disappear on its own. And as long as you don't have major issues, it goes away, then you should be completely okay. However, anytime you have an ulcer that comes in your mouth, and it is not going away after a few days, that's when you need to start worrying, because sometimes these ulcers could be a beginning sign of a cancer inside the mouth. So if they don't go away after a significant period of time, or at least 2 to 3 weeks, then you should be seeing a dentist or a doctor to see what is going on with your mouth. And I hope I answered this question for you.
Yeah, if something persists, I would always get it checked out.
Absolutely. Yes, sir.
All right, let's go on. Let's just go to question number 3. This one also comes from Cora. Let's see. Why do dental implant posts irritate the gum?
So the question is, why do dental implants irritate the gum tissue? So the simple answer is, whether you have a tooth or a filling on the tooth that is closer to the gum tissue, it is going to irritate the gum tissue because it is considered a foreign body, compared to like some kind of a material that may not be compatible with your mouth, or what we call it as a biocompatible, because they are not medically compatible. The the gum tissue gets irritated from the biocompatibility issue. So going back to why do you get dental implants, it could be it may not be just the implant itself, because you may not be practicing very good oral hygiene. That may be the reason why you are getting some irritation in the gum tissue. One of the most common causes that I see in the office is sometimes you get food packing in the dental implant area because the tooth may not be correctly fit onto the dental implant. So you may be thinking it is the dental implant that is causing the irritation in the gum tissue. It's not actually the implant itself. It actually the crown, which is fit onto the implant, that could be causing the irritation around the gum tissue. So long story short, there could be a variety of reasons why you're having some irritation. It could be because of the implant itself that is not positioned correctly, or the tooth that is fit onto the implant that is not fit correctly, or there could be some cement or the glue which was used to fit the crown or the tooth onto the implant, and that may be causing some irritation. And last but not the least, you may not be practicing good oral hygiene, or you may not be going to the dentist on a regular basis to get some professional cleaning done, and that could be causing some irritation also. So not just one reason, there could be a variety of reasons why you could be getting some irritation of the gum tissue from a dental implant.
Yep, and if you want to find out exactly why, come on in. We'll help you figure it out.
Absolutely, yes sir.
All right, let's move on. Question number 4. Can I extract a tooth or do any other dental procedure like cavity filling or teeth whitening while pregnant?
So the question is, can I extract a tooth or do other dental procedures like cavity filling or teeth whitening while pregnant? So when you are pregnant, it's not that any of the dental procedures are contraindicated. You can get as much of dental work as much as possible, and that is absolutely not a problem. But depending on the pregnancy and then depending on your physician that we are working with, some prefer one type of numbing agent to be used versus the other. And again, that may not be the biggest issue, but what we don't want to happen is we don't want to cause a lot of stress into your body. That may put a lot of stress onto the baby and cause some kind of a pregnancy issue. That is what we are concerned about. The best time to do any type of dental work when you are pregnant is the second trimester. Of course, it does not mean that you cannot get any dental work at all during the first trimester or the third trimester. You can, but the safest period during pregnancy to get any type of dental work will be the second trimester. So can you have a tooth extracted while you're pregnant? Yes, the answer is yes. And I have variety of patients and many patients that are being sent to our office from the dentists we locally work around in the area here, and they are being sent because they are afraid when they got a pregnant patient, they don't have the expertise to help them. And as a specialist office, and we have the expertise to help them, so immediately we contact the patient's physician to get a consult from their OBGYN and to make sure that it is safe for us to do the extraction, and then we do the procedures. And we do a variety of procedures when in our office when the patients are pregnant, like extractions, deep cleanings and things like that. But if it is an elective procedure that can wait, for example, if it is a small cavity that can wait until you deliver the baby, then my recommendation would be that you wait until you deliver. However, if it is an urgent situation or an emergency situation, like a toothache, you don't want to obviously be hurting the baby from the stress that your body will be going through by keeping the tooth. So immediately you want to get the tooth extracted. And then if you have severe periodontal disease, then that may cause some stress onto your baby or cause pregnancy complications such as preterm birth or premature babies and things like that. Then you obviously want to get them treated while you're pregnant. So again, long story short, can you get dental work done during pregnancy? Yes, you can. But if this is an elective procedure, I recommend that you avoid that during your pregnancy.
Yep, we're always looking at make sure you're healthy and taking care of your well-being. That extends to the baby, right?
Absolutely, yes, sir.
We want to do what's best for you.
And the baby.
And the baby.
Yes, sir.
All right. Next question. This one also comes from Cora. I have a cavity in the stage of a white spot. My dentist said I can't do anything and can only slow the process with proper oral hygiene. Will the white spot disappear if I brush my teeth regularly?
So the question is, I have a cavity in the stage of a white spot. My dentist said I can't do anything and can only slow the process with proper oral hygiene. Will the white spot disappear if I brush my teeth regularly? So the white spot that you're referring to, what we call it as a demineralization. So if you think about it, the tooth, which is most people think it is made of calcium, not just the calcium, it contains a variety of minerals. So if you have a white spot, that may be because you don't have the appropriate type of minerals or the appropriate strength of the minerals on that particular spot of the tooth. That is why you have a white spot, which is because of the less minerals or it is a demineralized spot. So your dentist said he cannot do anything. Yes, that is correct. Just because it is a white spot, it is not a big cause for concern. So that is why as dentists we say you don't have to really do anything about it, because the white spot may not always become a cavity as long as you take good care of it, other than the fact that if you don't take good care of it, there is a very good chance that if a cavity were to happen, the cavity will end up happening in that white spot because you do have less minerals in that spot. However, what the dentist said is correct. As long as you practice good proper oral hygiene, the chances of you to develop a cavity is very unlikely because you are keeping it clean. And going back to, will the white spot disappear if I brush regularly? Sometimes yes and sometimes no. If we see a lot of white spots or if we see certain white spots, if we feel that you are not getting enough minerals to your teeth by not using a proper toothpaste, then we tend to give you sometimes a high fluoride content toothpaste in terms of giving you a prescription type toothpaste, and the prescription type toothpaste will help you to give you extra minerals those white spots might need. So when you use those extra strength toothpaste and the minerals that you have in them, they tend to make those white spots disappear. Does it always happen? Possibly not. Does it happen sometimes? Yes, the answer is yes. So there are a variety of things that can be done. In addition to a toothpaste, the dentist can apply some high fluoride varnishes in their offices and things like that of nature to make that white spot go away also. And I hope I answered your question about the white spot here.
All right, let's move on. Next question comes to us from our website. Looks like Charlotte Glover submitted this question to us. I have a low income. Can you help me?
So the question here is, I have a low income. Can you help me? The answer is yes. And we go through this question or we go through this discussion pretty much almost every single day in our office. We are an office, we believe in trying to come up with a budget that is going to fit your lifestyle. So we are not going to give you a cookie cutter treatment plan. Hey, this is going to cost like $1,000 or $2,000 or $3,000, and hey, here we go, this is what you're going to need. However, if $3,000 treatment is what you need, that is what you need, and I can't really change the way the things are, and that is what you're going to need. However, what we do every day in our office is help prioritize the treatment. For example, if you came to my office and then if you have severe toothache, and let's say the tooth extraction is going to cost a couple of $100, however, you need $2,000 worth of treatment, then I'm not going to give you the $2,000 treatment on the day you walk into my office. However, I'm going to give you the treatment plan for the $200 tooth extraction and see how we can fit this into your budget. This is, for example, a payment plan option that we have. If you look at it, if somebody says, okay, I can only afford $87 a month, then we are going to find out, okay, the $87 a month for a period of 24 months, it is going to give you about a $2,000 worth of spending power to spend with our office. So going back to the example I gave you, if you told me, if I gave you the $2,000 treatment plan, and if you told me you can afford an $87 payment plan, then we can do a treatment for you for $2,000. And of course, it depends on the banks that we work with, whether they're able to offer you those type of payment plans. So going back to your question, if you have a low income, that does not mean that we cannot help you. We are able to help a variety of patients with a variety of income level and with a variety of treatment needs. Just talk to your dentist wherever you are and ask them what kind of payments options you have. And if you happen to be in the Dallas-Fort Worth area, come see us and we'll be happy to help you.
Yeah, you can come in for your free consultation, free CT scan. That doesn't cost anything.
There we go. Yes, sir. Thank you for reminding me. Yeah.
All right. Next question, again, comes from Quora. At what age should one start flossing?
So the question is, at what age one should start flossing? The answer is as soon as the teeth start coming through. So I have had patients in my office. Those patients are 3 or 4 years old and 5 or 6 years old, and they always see their mom and dad just standing in the bathroom and sitting on the couch wherever they are, and they're flossing, and they're asking, daddy, mommy, what are you doing? And then you are telling them you are flossing, and then they can get the habit from you, and they can even floss their baby teeth. That is absolutely no problem at all, as long as you teach them and they are not going to cut their mouth with a floss, and you can teach them, and that's absolutely no problem. So for example, if a baby has primary teeth that are coming in 6 months, and you're not going to probably show them how to floss because they don't have the dexterity to do that. But can a 6-year-old floss? Possibly yes. Do you necessarily have to use the floss with your fingers and use them? Don't have to. You can give them a floss holder. They can use it very easily. And not necessarily they have to use the floss, but you can have some alternative modes of, instead of flossing, you can have a tiny brush. They can use a baby brush. They can use to do something similar to the flossing. So going back to the question, there is no age for when you should start flossing. You can start as soon as somebody or the kid is able to floss. And I definitely recommend as soon as the permanent teeth start coming through, probably around the age of about 7 or 8 or 6 or 7, around that age, or as soon as the child is able to just learn some flossing technique, and I absolutely recommend anyone should consider flossing. And I hope answers this question.
Yeah, it's never too early to start a good habit.
Absolutely, particularly for a good habit, like Reese said. Yes, sir.
All right. This next question comes from our website again. Looks like Sheila Truth submitted this question to us. Do you take off wisdom tooth?
So the question is, do you take off wisdom teeth? The answer is, for the majority of the times, yes. Most of the time when patients come to my office, or most of the time when they go to the dentist, most of them get recommendation or to have the wisdom teeth out at the teenage years. So if your dentist or your surgeon or your periodontist recommends removing the wisdom teeth, absolutely go for it. I have no wisdom teeth at all. None of my family does. My wife, I removed my wisdom teeth. My sister and my brother-in-law and my brother and most of my staff, all of them had their wisdom teeth removed. Most of the patients who come to my office, as Reese knows, and we always recommend removing the wisdom teeth. Wisdom teeth removal is a big part of my practice, and we do it almost every single day. Sometime during summertime, we remove 10 to 15 sets of wisdom teeth a day. So the answer to your question is, you should really consider taking wisdom teeth off if you are at your teenage or if you're less than 35 years old. If you are older than 35 years old, then sometime depending on the condition, we recommend removing the wisdom teeth out, and depending on the position and multiple other factors, we may recommend either removing one wisdom teeth or all 4 wisdom teeth. Again, it depends on the patient. So long story short, to your question, answer to your question, should you consider taking the wisdom teeth off? Yes, you should consider taking the wisdom teeth out as early as your teenage years.
All right, yep. And while you're here doing that, we'll see if you have any other problems or issues.
Absolutely, that's another great thing. We can definitely help you. Yes, sir.
All right. This question comes from Gillian Gibbs off of our website. His question is, do you do laser gum treatment?
Great question. So the question is, do you do laser gum treatment? The answer is yes. So one of the things that we experience in the office is patients have severe gum disease and they go to the dentist and they are being told, now you need to have your gums cut open and you need to have gum surgery done. Now as soon as they hear the word surgery, they are really scared, and then they don't go to the specialist like me, or they don't want to come and visit any periodontist like me, because their dentist pretty much told them they need to have their gums cut open, and they are scary. The greatest benefit of the laser gum treatment is there is no cutting, there is no sewing, you don't need to have any stitches, and there is absolutely no fear. Think about what we call it as a minimally invasive procedures. Think of the olden days, and we need to have our belly open if we need to have any kind of abdominal surgery done. Now you don't have to cut your belly completely open. You can put a small pinhole in your belly, and then you can go get what we call it as a laparoscopic surgery just through the hole. Similar to that, the laser surgery, what we call it as a minimally invasive procedure to do any type of gum treatment or to treat any type of gum disease. And you got some great benefits, again, going back to no cutting, no sewing, and no pain. So going back to your question, do we do laser gum treatment? Yes, we do gum laser treatment, particularly for patients with advanced gum disease where they cannot be helped by a regular dentist. And if you are in need of specialist services like a periodontist to help you, yes, pick a periodontist who can do the laser gum treatment for you. Yes, it will be absolutely beneficial. And if you are in the Dallas-Fort Worth area, come see us, and we have the laser gum treatment, what we call it as a LANAP, LANAP, the LANAP treatment, we can offer that for you. And I hope this answers your question.
We're a fully modern office offering the latest technologies and practices, aren't we?
Absolutely, sir. So just like Reese said, laser treatment is one of the greatest innovations in the technology. We are able to help patients with this minimally invasive treatment.
All right. Next question. This one's back to Cora. Do braces cause white spots on teeth?
Great question. So the question is, do braces cause white spots on teeth? Yes, they do. So going back to one of the questions that we discussed earlier, so you get what we call as a demineralization. Sometime we talked about how the toothpaste affects the surface of the tooth. So let's say, for example, so if you have a dry skin and you always apply lotion, and the dry skin you don't have any problem. But imagine you skip a particular area, and let's say you have some dry skin in the dorsum of your hand right here. You never apply the lotion here, you only apply to the hand, and you can get rid of the dry skin in the hand here because you're not applying the lotion here. Same thing, for example, if you have this part of the tooth covered with the braces or the bracket of the braces, anytime you apply the toothpaste, this part of the tooth that is covered with the braces, this is not getting the adequate minerals that you need. We talked about the mineralization. So if you're not doing the mineralization or the remineralization process does not happen, then that is why you cause white spots on the teeth. So majority of the times you may not see that white spot until the band is removed, and I'm thinking you are referring to the white spots that you saw as soon as your braces were removed. So my recommendation would be to start applying those toothpaste and then start using the toothpaste on a regular basis. Then most often these white spots will go away. Or talk to your orthodontist or your dentist and see whether they can prescribe you that high fluoride toothpaste that we are talking about earlier, which is a fluoride toothpaste which has 5 times stronger fluoride than the one that you get over the counter. So then that will help you remineralize the area, so that way these white spots can disappear. So a couple of things I recommend you do in addition to brushing the area. I highly recommend using the toothpaste multiple times, the prescription toothpaste I'm talking about. Use it to you replace your regular toothpaste for brushing once or twice or thrice a day. And then in addition, after you brush and floss and rinse your mouth and ready to go to bed, now you take a little bit of the toothpaste, apply onto the area either with a clean finger or using a Q-tip, apply it, spit the excess out, don't rinse your mouth, and even if you swallow a little bit of that fluoride, that's completely okay. Go to bed with that. Now you have that remineralization process happens throughout the night. Now those white spots will tend to disappear a little bit faster compared to if you were to just use it as a toothpaste. And I hope it makes sense what I'm saying, and hope I answered your question.
And any additional cleanings really help.
Absolutely, yes sir.
All right, next question. Is it okay if I stop my regular dental checkups during pregnancy?
So the question is it okay if I stop my regular dental checkups during your pregnancy? Absolutely not. I do not recommend you stop your dental checkups, particularly during pregnancy. One of the key things that we talk about in our office, and particularly being the gum specialist, and gum disease can cause a variety of complications to your body. In addition to the variety of complication it can cause to your body, it can cause pregnancy complications too. One of the most common complications that we see are premature or preterm labor and premature pregnancy, and those are the pregnancy complications that we see as for as periodontists on pregnant patients. So can you get gum disease during pregnancy? Yes, the answer is yes, because you're not able to brush, and sometimes you may not be able to brush and floss your teeth properly and to keep them clean because they're always bleeding because of the hemodynamics that your body is going through from pregnancy. So you need a lot more TLC, the tender loving care, for your gums during pregnancy. So if you are able to keep up with your cleanings and you are able to keep up with your cleanings, then it is going to reduce the pregnancy complications from the gum disease because you're able to keep it clean. And what my recommendation to my pregnant patients is, instead of doing 2 cleanings a year, you do 4 cleanings a year during a pregnancy. That way you even absolutely minimize the complications of getting any type of complications into your pregnancy from any type of gum disease you can contract during pregnancy. And think about this, cleaning is the simplest thing to do, and you can afford to do that, and you cannot afford to have any type of pregnancy complication. You cannot afford to hurt the baby. So if you want to be preventive and you want to absolutely prevent any pregnancy complications or absolutely prevent any complications to your baby, absolutely do not stop your dental checkups during your pregnancy. Do not stop cleaning your teeth. Of course, do more cleanings during a pregnancy, and that is what I would highly recommend.
Yep, anything beneficial to your health, really. You want to
and the baby.
And your baby.
And your pregnancy.
Yes, sir. All right. Next question, back to our website. This one comes from Joel Johnson. Question is, hi, I want to know how I can pay for an implant in the front left side teeth. It's broken, need it out and replace. I have no insurance. I would like to know, how can I get it done?
So the question is, hi, I want to know how I can pay for an implant in the front side of the tooth. It is broken, need it out and replace. I have no insurance. I would like to know, how can I get it done? So the simple answer is, you can come to our office or you can go to any dental office who can offer you a payment plan that is going to fit your lifestyle and budget. For example, dental implants cost anywhere between $2,000 to $3,500 or $4,000 or maybe even a little bit more. Let's say you are able to afford $100 a month. Sometimes dental offices are able to offer as low as maybe about $100 a month over a 20-month period. And let's say you are able to afford a $200 a month, and let's say if you need a $4,000 in implant, if that is what it's going to cost you, then again they can offer the same 20-month payment plan over a period of 20-month payment plan with a payment of $200 a month for a $4,000. So anyone who does not have dental insurance, don't be shy not going to the dentist that you cannot afford. A lot of times you may not know when you go to the dentist, many dentists offer many type of payment plans that's going to fit your lifestyle and budget and your case. And if you have a front tooth broken, talk to your dentist and see whether your dentist offers any type of payment plan, or do a Google search for a local dentist offering payment plan, and you should be able to find one right in your area. And if you happen to be in the Dallas-Fort Worth area, come and see us, and we'll be happy to help you.
Yeah, don't let money be an issue. It's your health, and you want to make sure you're doing everything you can to keep yourself healthy and your mouth healthy.
Absolutely. For a front tooth, and you don't want to be walking around with a snaggle tooth, and you definitely want to get that get your tooth fixed, and you keep looking sharp, man.
All right. Next question. Back to Quora. This one's followed by 5 people. How should you properly care for your tongue?
So, great question. How should you properly care for your tongue? So, this is one of the most ignored spot in your mouth. So, anything that you do not clean inside your mouth and that gets yucky, excuse my language, and that is not clean, that is an absolute dirty spot that you're going to have a lot of bacteria. The gums, the teeth, the tongue, and the back of your throat, the roof of the mouth. There are so many places these bacteria stay, and they will stay forever if you don't clean them. If you don't brush your teeth, they're going to get yellow and then they stay in your mouth. And same as your tongue. If you don't clean your tongue, then they stay in the mouth. So that is the reason why you need to care for your tongue. How do you properly care for your tongue? The simplest technique that I recommend, you brush your teeth. So after, what I normally recommend is, I do this pretty much every single day. And my staff even hears that when I brush my teeth inside my office almost several times during the day after my lunch. And Reese is nodding, you can see, ask him. And just now I had dinner before I came to this live show, and I was brushing my teeth after my dinner. And what I do is, after I brush my teeth, and I either use the same brush with the toothpaste on it or with no toothpaste on it. I just stick my tongue out, I clean it, and then again do it 2 or 3 times a day, and that's the minimal I recommend. If you're doing it multiple times a day, and I brush my teeth about 5 or 6 times or maybe even more, and every time I'm brushing, I'm just using my toothbrush to clean my tongue. That is the minimal you need to do, and that is more than what you need, and that is exactly what I do to properly care for my tongue. Can you do anything extra? Yes, absolutely. There are a variety of tongue cleaners. Go to Amazon and look for a tongue cleaners, and there are a variety of tongue cleaners that are available that you're able to use. And if you don't feel comfortable using a toothbrush, and you can use, or if you are not like me, you are brushing your teeth or tongue multiple times during the day. If you're doing it only once or twice a day, you can use those tongue scrapers. Pretty much you stick your tongue out and you clean your tongue using those tongue scrapers, and that is one of the best ways you care for your tongue also. And no matter whether you use a toothbrush or you use any type of specific tongue cleaners, absolutely that is the way to care for your tongue, either using the toothbrush or the tongue cleaners. And you can use some mouthwashes also, but that will help on the top of the brushing and the tongue cleaners, but they are not the replacement for the tongue cleaners or the toothpaste.
All right.
Sorry, toothbrush, I mean, yeah.
All right, let's move on. Next question. Coming back to Cora. Are we more likely to get a tooth cavity in the upper or lower jaw?
So the question is, are we likely to get a tooth cavity in the upper or the lower jaw? So the answer is, you are likely to get a cavity either on the upper or the lower jaw. So there is no difference between the upper or the lower jaw. And to my knowledge, I don't think any research or any scientific studies even being done which tooth gets more cavities. However, we do see more cavities which teeth get more cavities, in the sense whether the upper teeth or the lower teeth. I don't think any difference. However, we do see that the back teeth get more cavities than the front teeth. That is because those are the chewing teeth, and you tend to chew a lot more in the back, and because you tend to chew a lot more in the back, and there is a lot more food getting stuck in the back, and that is the reason why you get more cavities on the back teeth than the front teeth. So to answer your question, whether the upper teeth or lower teeth can get more cavities, and I don't think there is any difference, because whenever you chew, you use both the top and the bottom teeth. So to answer your question, there is no difference.
Yeah, maybe it's with their technique or something. They're focusing mostly on the
well,
top.
that is a great point you brought up right here. So depending on whether you are using the right technique, and what I was going to say was, some people have a tendency to brush their top teeth better than the bottom teeth, and vice versa. For example, like my son, he always misses the lower front teeth here because he's not a good brusher, because he has a problem in pulling his lip out to brush his teeth, and he always misses his bottom teeth in the front here. So if you are not a very good, if you're not like paying attention to which teeth you are missing, then it's possibly, if you're missing top teeth more than the bottom teeth, then you may be a person more prone for cavities on the top, and somebody who misses the bottom teeth, they may be more prone for cavities on the bottom. And then in addition, also depending on the type and the number of teeth that you have in the back, and if you have, let's say you have some missing teeth on one side versus no missing teeth on the other side, that may affect whether you have top or bottom teeth. You may have more cavity. And sometimes people tend to have wisdom teeth. They did not remove the wisdom teeth, and the bottom wisdom teeth that we see, they have a tendency to get more cavities because you tend to have more food trapping that happens on the bottom wisdom teeth because of the gravity. The food just gets stuck in the bottom here between the hole between the last tooth and the wisdom tooth. So there are a variety of factors in addition to whether they are the top or the bottom teeth that could be contributing to more cavities in the back teeth and more cavities in the top versus the bottom teeth. And I hope it answers your questions.
Yep. Either upper or lower jaw will help you.
How are we doing on the time?
On the time, we have about 10 minutes left.
Awesome, very good.
All right, next question. How will removing 2 upper jaw premolars to provide space for my front teeth to move back affect my face and bite? And should I take the risk of removing teeth?
So the question is, how will removing 2 upper jaw premolars to provide space for my front teeth to move back affect my face and bite, and should I take the risk of removing the teeth? So I'm going to answer this question in multiple parts here. So how will removing the 2 upper jaw premolars to provide space for my front teeth to move back? So if you think about that, if you have severe crowding of your teeth, imagine if this is the complete set of teeth that you have, and if you have a lot of crowding, your teeth are like this, all the way crowded like this, and they are not straight. And if you have a lot of crowding, then there is no way you can move the teeth to the back. So the only way that you can move those teeth is to gain some space in the back. And the orthodontist or dentist recommend to be removed to gain some space to push those front teeth to the back. So it is not uncommon for either the 2 premolars on the top or the 2 premolars on the bottom or all 4 premolars to be removed, or 3 or 1 or 2 or 3 premolars to be removed, or sometimes some of the front teeth to be removed to correct the crowding. So it is not uncommon at all. And then the second part is whether it will affect your face or the bite. Think about that. If somebody has protruding teeth, and that is affecting your face because you got some protruding teeth, and your lips may not be able to close, and then you may not like your face because you got a protruding teeth. However, removing the teeth, in this case the premolars, will affect your face in a positive way, because now the teeth are going to be pushed back. Now your bite is going to get better, and you're going to start to look pretty for women and sharper for men, right? So more than likely it will affect only in a positive way, not in a negative way. If it is going to affect in a negative way, then your orthodontist or dentist should be able to discuss with you. And I don't think that would be the reason, because if that is the case, they won't be recommending for the extraction to begin with. So then the next part of the question is, should I risk removing the teeth? And again, there is absolutely no risk involved in removing the teeth as far as your bite or the shape of your face. Do you have risk in removing teeth? the chances of having any type of complications or any type of risk is almost very minimal or almost none. So I don't think you are going to take any risk in removing the teeth, particularly for a reason that you are getting some braces to make your smile better and make your face look pretty or face look sharp, and there is absolutely no reason you need to be concerned about.
Yeah, you can come to Dr. V and he'll even minimize that risk even lower.
Absolutely, yes sir, thank you.
All right. Second to our last question, is it normal that food gets stuck in my dental implant? If so, why do dentists make an implant with a gap?
So the question is it normal that food gets stuck in my dental implant? If so, why do dentists make an implant with a gap? So I'm going to see whether I can answer this question for you with the possibilities of why this could be happening, because without knowing the problem, I obviously cannot tell you why this is happening. So is this normal that food gets stuck in my dental implant? So again, the question is it normal that food gets stuck in my dental implant? If so, why do dentists make an implant with a gap? So is it normal for you to have food getting stuck on the implant? No, it is not normal, as long as the implant and the tooth on that was done correctly. Anytime we do a dental implant, my patients always ask me this question: Doc, how does a dental implant work? And I tell them, a dental implant, whenever we do a dental implant, my goal is to give you something that is going to look, feel, and function like a natural tooth. So if you had a natural tooth removed and if you did not have food getting stuck in that area to begin with, the chances of a correct way to do an implant, or if you do an ideal implant, and you should not have any food getting stuck in there. Most of the time when we do a dental implant in our office, and because we specialize in this area here, so we will be doing an implant that's going to look as ideal as possible, that's just going to look, feel, and function like a natural tooth. And if we did so, and there is no chance for you to have any type of food getting stuck in that area. However, if the food is getting stuck in the area, it could happen for a variety of reasons. It could be due to the positioning of the implant, the way the implant was done in the bone and it was placed inside the bone, or it could be the way the tooth was placed over the top of the implant, or it could be the shape of the tooth that was placed on the implant, or it could be like the way that you had mentioned, there is a small gap, and if there is a small gap in between the tooth or multiple implants next door, if there is a gap, or if there is a tooth and an implant and if you have some gaps in between, there is a possibility that there could be some food packing that is happening. So whatever the case may be, talk to your dentist, and it may be a simple fix. And we have had some occasions, and we have seen multiple implants and we are getting some food getting stuck, and we are able to have a simple fix. And if it is, like I said, if there is a gap between the crown and then the tooth next door, and that is the reason why you are getting food stuck, and it may be a simple fix, and we may need to remove the tooth attachment, make some adjustments and put it back. Or sometimes what happens is, after we put an implant, the tooth starts moving over a period of time. Then it may be a good implant to begin with, but then over a period of time you're starting to get some food packing. Again, a simple fix, and remove the tooth and make some adjustments, and then we can put it back for you. So talk to your dentist wherever you are, and if you happen to be in the Dallas-Fort Worth area, come and see us, and we'll be happy to help you.
All right. Looks like we have one question left. Let's see what it is. What is an active dental implant? Is there any difference between an implant and active implant?
So the question is, what is an active dental implant? Is there any difference between an implant and active implant? So I think this follower is referring to is a brand of implant, what we call it as an active dental implant. So for example, we have a variety of brands of implants that we do in our office. For example, in my office, and I do a Zimmer dental implant. I do a Straumann dental implant. I have Nobel dental implant. I have Astra dental implant. And you may be going to somebody else and they may be doing a BioHorizon dental implant. Somebody else may be doing a Toman dental implant. Somebody else may be doing a Hyacin dental implants. So those are a variety of brands of implants that are available. So Active is a type of dental implants. Active is a brand of dental implants made by Nobel Biocare. So I think that is what you're referring to, an active dental implant made by Nobel Biocare. So there is no such thing as active dental implant or passive dental implant, meaning the implant is active and sometimes we see a passive implant. Although sometimes we refer to passive or sleeping dental implant in the sense sometimes we do a lot of dental implants and for a person and we may end up not using dental implant and we completely leave it underneath the gum line, and at that point it becomes a passive dental implant or a sleeping dental implant. We are not using that to restore the prosthesis. For example, let's say you have missing teeth all around the mouth and you have this mouth right here. Now you got full of dental implants and we put 1, 2, 3, 4, 5, 6 dental implants, and now the one of the implant we really don't need it because that is going to affect the way the prosthesis is being made. Now we are going to end up using only 5 implants instead of, although the patient has 6 implants, and we may call the 6th implant, which we are not using as a part of the prosthesis, we may either call it as a passive dental implant or we may call it as a sleeping dental implant. So to answer your question, an active dental implant could be referred to either an implant that we are actively using as part of the restoration as part of the prosthesis, or it could be referred to the Nobel Biocare active dental implant. And I hope answers this question.
All right, so it looks like that does it for us tonight.
And thank you so much all for joining us, and thank you for taking the time to submit these wonderful, wonderful questions. Think about this, and if you are the one watching it, and if you are going to be the one submitting the question, you are not going to be the only one benefiting. You are not only helping yourself and by submitting this question and watching this question, but you are also helping the community and all the dental community. People are listening and all the patients who are in need of help. And as you guys know, these questions come from a variety of people here from us, from Quora and our website and YouTube and multiple other resources. And you're helping a lot of people watching this through our social media. And thank you again so much for submitting all these questions, for taking the time to do this. And thank you for following us, and thank you for taking the time to watch us tonight. And we really look forward to helping you all and helping the community, and look forward to joining you all next month. And until then, bye for now.
See you next time. Take care.
Thank you. Bye. Yeah.